Political Capital is brought to you by Uber Canada. Learn more at uber.com/flexibilityworks.
CHEK Podcasts.
Hey everyone, and welcome to Political Capital, your source for all the latest in BC politics. I'm your host, Rob Shaw, coming to you from the headquarters of the glamorous media empire that is my living room, courtesy of the cold and flu season in BC. I didn't want to get anybody sick, so here I am in my headquarters. This week, BC did set a record for the number of people in hospital, so I didn't really want to add to that with my sniffles, which are both very manly and also devastating. So keep me in your prayers. Anyways, we are going to bring in the panel to talk about things this week. Our first show of 2024 is quite a bit actually that happened during the Christmas break. Do a quick introduction here. We will start with Jeff Ferrier from FramePoint Strategies, a former NDP strategist and communications executive from the Ministry of Health. Jeff, thank you for being here.
Thanks, Rob. That was a great introduction. You really nailed it this week.
That's all. It's all I got. It's all I got. I'm giving everything I got. Jillian Oliver, a former BC Green strategist who ran Sonia First Snow's leadership campaign. And Jillian, is there any personal news you'd like to share with the viewers as we start 2024?
I'm going to be taking a break from the show in a month because I'm having a new baby for the new year.
Yay!
Yay!
Way to go, Jillian.
Thank you.
That's great. You ran Sonia First Snow's campaign, leadership campaign, while pregnant also, right?
Yeah, and the 2020 provincial campaign with a newborn. Good times.
Wow. And it's an election year, so there you go.
Yeah,
That's
timed it perfectly once again.
Yeah. And Allie Blades from MASH Strategies worked on BC Liberal campaigns and helped run Pierre Poilievre's federal Conservative leadership campaign here in BC. Hello, Allie.
Hello, it's my favorite day of the week.
That's right. It's our Friday show. Maybe you're listening to this on a different day of the week, but we're recording Friday morning. And we want to start with that BC Supreme Court injunction against Premier David Eby's law that was passed in the fall to regulate open drug use in public spaces. A law that proposed ban on open drug use 6 meters from doorways and at bus stops. Also, I think it was 15 meters-ish near public spaces, beaches, playgrounds, that type of thing. So it was an attempt by the NDP to respond to some of the concerns from decriminalization and the public disorder and the inability of bylaw officers and police to move people along. But it has not passed the initial court injunction test, and its constitutionality is being debated. So anyways, the Premier got this week unhappy with that. So let's start there on what I think that might mean for the government and how we sort of analyze where decriminalization is at in terms of even public sentiment and political calculations here at the start of 2024. Allie, why don't we start with you?
Sure. So let's rewind a little bit and remind the listeners and the viewers that we're in year 2 of 3 of this experimental project. This new ruling, though, from the Supreme Court, I think is a little bit of a blessing to the NDP communications in an election year, just because it's not something that they chose. Rather, it's something happening to them, and now they have to figure out how to respond and kind of put their hands up to say it wasn't my fault. It seems like they haven't really taken a solid position one way or the other and kind of orbit around the issue in the safest way possible. But all that has led to is essentially not so much in the way of moving the dial in any of this, more deaths, no real solution coming out of this. And so I wonder if it's time to just call it quits and reverse all of this and focus on something else. We over the holidays saw Brad West say that this restriction doesn't stand, that we truly entered the wild west of unrestricted drug use. I mean, those are bold words, and I think we're looking for bold action from the government, and we're not really seeing it.
We haven't been in the Wild West since political fundraising in 2016, I think was the last time we were in the Wild West.
I thought we all forgot about that.
Jillian, like, where even are we on decrim at this point? Because, decriminalization was supposed to prevent people from being subject to arrest and seizure for personal possession of small amounts of drugs. And now we have a bill that the government has passed and is fighting in court that, brings back arrest and seizure of people in public places who use those drugs. And where is the public and where is the politics on this? And how do you think this court ruling kind of factors into all of that sentiment?
Yeah, I think, first, I think there is some misinformation out there. It is still illegal to use drugs in playgrounds. The original Health Canada exemption to decriminalization already allowed that. The law that has the injunction now sort of doubled up and expanded that, and also gave the police the ability to arrest people and to confiscate their drugs if they suspect them of being high in these spaces. So still illegal to use drugs in playgrounds. But yeah, I think the government has been reluctant to move forward with decriminalization from the get-go. They're sort of caught between, where they think the vast majority of public opinion is, where this is, a big step that's very controversial. People have a lot of concerns because of, the feeling on the ground in their communities with respect to public drug use and the evidence. We had Dr. Bonnie Henry, harm reduction advocates, doctors, all kinds of folks who are looking at the evidence saying that this is an important step to reduce deaths from toxic drugs, which is, it's the second leading cause of death in BC. We're in I can't even remember what year of a public health crisis, many years into a public health crisis, 6 people dying a day, very serious. And I think, the government was feeling pressure from those advocates who they have relationships with, and also, feeling like they should follow the evidence and listen to experts. But they moved forward with a lot of trepidation. They really watered it down. And now I think they're just not comfortable spending any political capital pushing this forward and sort of, leaning into the leadership required to move the dial on the issue because of the controversy. And I think that that's sort of a pattern that we've seen with the NDP government, where when there is a controversial issue that starts to sort of, get them negative attention in the news and the public, they pull back on it, whether it was the RBC Museum or, other things like that. When it comes to these sorts of issues, they really don't want to distract from the core of their agenda, don't want to dive into political issues, politically controversial issues, even though, they've got a 20-point polling lead. They're just not willing to sort of go down any further to move something like this forward.
It kind of leaves the government, Jeff, in like the worst case of both worlds, where they've gone towards something that advocates say they are undermining, which is reducing stigma of drug use so that people can get help. But they're not going far enough on this side, but they've gone too far on the other side for critics and mayors who say that it wasn't well considered and has led to these side effects that require this legislation. And they're stuck pleasing almost no one right in the middle of this policy, including the courts, which have put this injunction in place.
Which is usually where government needs to be if it's in the process of doing its job. By the way, Allie talked about Wild West. That's also the nickname of the mayor of Port Coquitlam. For talking about that. Wild West. Look, here's how I see it. Starting point, the Harm Reduction Nurses Association, these are the folks who launched this challenge. They're trying to save lives in a toxic overdose crisis. Lots of folks have said lots of things about them and what they're doing. They're coming at this from a really good place, and I commend them for doing that. I would say, though, that the reaction from them not from them, but from folks in this space, since the court decision, misreads public opinion, and it hurts the group's cause. I think the misread here is that people out there who are concerned about drug use in public spaces are all Trump-loving Joe Rogan fan bros. They're not. That's the biggest miscalculation since Rich Coleman said housing in BC is pretty affordable. The government is not worried about the fan bros. They are worried about progressive people like Brad West, like others who notionally support what BC's doing on decrim, but have stumbled in their daily lives across hard drug use, use needles, people behaving aggressively while taking their kids to school, while going to playgrounds, while going to get groceries, coming home from daycare, and they've got concerns. And the harm comes from folks who, when people express concerns, people like Brad West, they call them names. He's been called liar. He's been, said that, you're fear mongering, it's misinformation, and dismissing the fear, which is counterproductive, because when you do that to Brad West, you're doing that to all those moms and dads, the people you need to keep on side if you want to keep decrim and safe supply and harm reduction going, which is what the premier is trying to do here with this law. He's trying to keep those reforms moving forward while addressing concerns from the public. So, and the outcome of that, of going hard against folks like Brad West, instead of trying to work with them and engage them and allay the fears and move forward in a positive way, is that you push all those folks that you need on your side back towards the old approach, where addiction is a moral failure and the only way to save lives is for people to clean themselves up, which is not where we need to be.
So where does government go now then? Let's go around on that. It feels like, and I listened to Premier David Eby's comments this week where and I wrote a column about this, where he's co-opting the language of his critics that he used, a year ago, dismissed as fear-mongering in the legislature by comparing his inability to regulate hard drugs to, people drinking a beer in a park or smoking restrictions. And if government can regulate that, why can't they regulate drugs? That was exactly the debate we had 9 months ago in the legislature. Why can you not have a beer in a park, but you can smoke crystal meth without impunity, and nothing can be done about it? I'm just wondering where the NDP goes now, if they have shifted their position so much in the last year. And Jeff, as you mentioned, the public sentiment is not maybe where they started. Do they continue on down this path, or especially with BC United proposing to get rid of decriminalization altogether? Where do you have to land on this issue to resonate with public opinion? Jeff, quickly with you, and then we'll go around again.
Sure. Yeah, real simple. Get open drug use away from places where moms and dad take their kids, and make it so that people who have I had kids go to a school in downtown Vancouver, and every morning someone would go around with a white bucket and those tweezer things and pick up used needles. And I think that the government needs to show progress on allaying those concerns and fears, to make those folks feel like the government has it under control, and so that the work they're doing on decrim and harm reduction and safe injection sites and safe supply can keep moving forward.
Allie, where do you think the NDP has to go on this, given public sentiment?
I think they have to choose a lane here. So I'll very quickly try to say here that the chief coroner, one, is leaving in February, but as she departs the role, she's made some comments. One, that it's become hyper politicized and that the resources haven't amounted to the crisis levels that this deserved. So she's been in the role for quite some time. Minister Adrian Dix has also been in the role for quite some time. They've had the time to figure this out, and time's running out because we're in an election year as well. So people are going to be paying attention in a significant way, not even just the families impacted by this. If Jillian, you mentioned that they're already seemingly pulling back. Why not just pull back and just wrap this up and move away from decrim altogether, and maybe start fresh with a different idea, because it's not working?
Well, we are hitting the 1 year mark where the government will presumably provide some evidence on how this has gone as a 3 year pilot project. And I don't really know what that is going to be. Jillian, do you think government will continue to pull away, or, they're up against parties that want to scrap this entirely? Do they have to stick it out given the capital they've sunk into this already?
Yeah, I mean, I think it's interesting. It's an interesting issue for the premier. On some issues, he's so clear about, where he stands and what he knows to be the right thing. On the sort of issue of mental health and addictions, we do see him kind of struggling with it. It was the same with the case of involuntary treatment, where initially during his leadership campaign, he said that he was going to look at that. And then when he looked at the evidence, he changed his mind. So I think that is a really good place to sort of center the leadership. of the premier's office is to follow the evidence and to show that you're genuinely trying to advance this. I think there's other things the government can do, like expanding safe consumption sites. We haven't seen increased funding. There's still limitations on those. That will go a long way to help solving this problem without actually backtracking. And then I think also by leaning more into safe supply, there's a study out of first major study of opioid substitution in BC that shows that people with access to prescribed opioids had a 61% less chance of dying from an overdose or a drug poisoning than if they didn't have access to that. But we only see that program rolled out to a very small fraction of people who use drugs, only about 4,000 people, when the coroner estimates it's about 250,000 people in BC who are using illicit drugs. So I think that they've made progress. It's been slow and it's been too small. They need to expand it so that we can start seeing a reduction in those numbers, because the problem's not going to go away by backtracking.
Mm-hmm. We have not seen any reduction in overdose deaths, meaningful reduction, 2023 being another record year. So it feels like we're at a kind of decision point of whether we need to go further into safe supply and decriminalization, regulating the drug use like the coroner has suggested and others, to try to make a difference here, or get out of this entirely and refocus in a different way. And I guess that's going to be the debate. How do we save more lives this election year? Let us move to a new poll from Angus Reid showing just a complete collapse in public confidence in the healthcare system since the pandemic. I guess that's not surprising, but the drop is starkest in British Columbia from, I believe, around 63% approval of how government's doing on healthcare in 2020 down to 27-ish% this current year. So I just want to start there and talk about what that means, because it looks like it might be maybe a glimmer of hope for opposition parties, trying to find an issue with traction against this government. I'm not sure if we agree on that. Jillian, sticking with you on that, what do you make of those numbers and the kind of potential political calculations that can be made from them?
I think it shows that the door is open for opposition parties to make their case come election time. There's a lot of people that don't kind of tune in or start thinking about their choice really seriously until the writ drops, because people are busy and they're not BC poly nerds like us. But so far they haven't shown the ability to do that. BC United is a little bit lost with respect to its identity, sort of chasing the Conservatives, finding it hard to nail down who they are and how to tell that story to voters. Conservatives, I think, remains to be seen if they can let go of those fringe issues and, really resonate with the mainstream. And I think the Greens, have lots of good ideas, but they've got to convince voters that they're a really viable option. So there's a lot of work for them to do. And I think that, these dissatisfaction numbers are something that we're seeing for every province across the country. I think there's a lot of sentiment among voters that these problems are so big. It's not a question of like who's going to fix them all, but who's trying the hardest and who's best placed to at least manage them. And I think there still is continued trust in the NDP because of lack of scandals, lots of trust from the kind of COVID era management that explains the sort of discrepancy between vote intention and the approval numbers on these issues.
Yeah, when I asked Kevin Falcon about that discrepancy, that people are angry on issues, 81% of people think government's doing a poor job on cost of living and 83% on affordability. And then you have those healthcare numbers. He said those are more realistic numbers because people know where they stand on if they're upset or not about how government's doing right now on an issue. And the voter intention numbers don't matter much because people aren't paying attention 10 months before an election on who they really want to vote for. I don't know, Jeff, what do you think of that? If that explanation holds up to you, do the issues numbers we see mean more in the real world than the voter intention numbers?
That's probably Kevin Falcon's walking poll telling him, giving him his insights there. No, it's silly. He's saying the numbers that are good for me, trust those, and the numbers that aren't good for me, though, forget about those. Look, this poll is like the old Who song, meet the new poll, same as the old poll. continue to see big concerns about healthcare, housing, cost of living, and the government's performance on those. And yet most British Columbians say that they trust Premier Eby and the NDP to tackle them. And we didn't talk about economic performance, even though that's also in this poll. BC NDP scores pretty well, which is good for them in an election year, because typically the NDP will lose elections when economies aren't doing well. And they have a lot more resiliency in their brand on issues like healthcare, where folks instinctively have more trust in them than the more conservative parties. Real quick, I think there's two factors that are driving these numbers in all of the provinces, here in BC as well. One is growing population, 150,000 new British Columbians last year. Really a good thing for the province, but brings challenges in terms of providing services like healthcare. So that's driving access issues in part, along with aging population and lots of other things. And I think there's also this post-COVID fear and expectations that we were okay to hang on by our fingertips during the crisis, but now that the crisis has passed, we're expecting government to make healthcare resilient, far better and more resilient, so that the next time there's a crisis, we're way better positioned to do it. And despite the government putting lots of money into recruiting health workers, lots of money into operations, lots of money into building new hospitals, the public concerns remain. So government needs to keep working at it.
Allie, just quickly, what do you make of these numbers?
So when we take a look at how all the polling intersects, the NDP get failing grades on managing the province, but they're still number one in voting intentions. We've all kind of summarized that. But to Jillian's point, I think this is also because the three opposition parties haven't given voters enough trust in them. So we're willing to endure the mess that we know. So the BC United are saying we have to fire Minister Adrian Dix. News Alert, that's winning Vancouver Kingsway. That's how you fire him. The BC Conservatives want to fire Bonnie Henry. That's not health policy. That's just being angry. And so both are they're not really offering much. So I don't think that's going to do anything.
Mm-hmm. Okay, great. Thank you to the panel for being here. Thank you for watching. There's a lot coming up in BC politics, so make sure you stick with us, subscribe, watch past episodes on CHEK Plus, and stick around for more audio podcast content as well. Thank you for watching. We'll be back next week here on Political Capital. Political Capital is brought to you by Uber Canada. Learn more at uber.com/flexibilityworks.